Good afternoon, everyone, and welcome to this COVID-19 Emergency Operations and Emergency Management press briefing for today, May 18th. We are presenting this press briefing via Zoom so our media partners can be socially distanced and protected during this COVID-19 pandemic. As you will note, if you are participating via Zoom, you've been muted. You'll have the opportunity to ask questions. Please do so by either raising your hand by using that button or hitting star 9 if you're participating via phone. And that will alert our moderators that you have a question, or you can simply text your question into the chat box and they can ask the question for you. If we don't get to your question, we can answer that question or send it to whoever the most appropriate representative is and get that question answered for you in a timely response. All of our speakers today, except for Dr. Nafissa today, will be socially distancing and participating via Zoom and electronically here with us today. Today's focus is on businesses, and so we have representatives from throughout the Cedar Valley in respect to how the pandemic has affected the business community, and how this measured stand-up or start back up is going to affect them as well. So it's my pleasure to kind of kick off today by introducing our incident commander and the director of public health, Dr. Nafissa Cisse-Egbuonye, and then we'll get into the opportunity to talk about businesses today. Dr. Nafissa.
Good afternoon. Today's not Thursday, Monday. As of Monday at 12:30 p.m., there is a total of 1,843 reported cases. We have an additional death, making our total 32. We've had 100 people who've been hospitalized total. And of the reported cases in Bjerke County, we have 1,072 people who have recovered. We have tested 7,074 individuals. We have an additional long-term care outbreak, which makes it the fourth confirmed in the county, and it's Pillar of Cedar Valley. Last week, I was asked questions in regards to inconclusive test results, and we've looked at that. As of today, Bjerke County has received a total of 21 inconclusive test results. The State Hygienic Lab has expanded the testing criteria for PCR testing to include the following: children receiving care in and staff working in child care homes and child care centers with fever or respiratory symptoms without any alternative diagnosis can now be tested for COVID-19. In addition, serology testing has developed, the State Hygienic Lab has developed testing criteria for serology testing, which is now available through their lab. And the testing criteria includes suspected or confirmed cases of COVID-19 who are more than 7 days past the onset of symptoms, to identify donors with an antibody response to donate convalescent plasma, and healthcare workers, essential services personnel, first responders, or other critical infrastructure workers for whom knowledge of antibody production is needed. With travel now, for individuals traveling or planning to travel, please note that COVID-19 virus is still circulating across the United States. So while there's no longer a recommendation to self-isolate for 14 days after returning home from travel outside of Iowa and within the United States, everybody should continue to please wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol, and cover all surfaces of your hands and rub your hands together until they feel dry. Avoid touching your eyes, nose, and mouth. Avoid close contact with others. and keep 6 feet of physical distance from others. And avoid close contact is especially important if you're at higher risk of getting sick from COVID-19. Wear a cloth face covering in public and cover your cough and sneeze with an elbow. I just want to thank everybody who's been listening to us. I know these have been difficult weeks, difficult months, but thank you for all who've been listening to us here at the EOC. I know that people are ready to get back to their normal routines, and with some businesses reopening, it's very exciting, but it's very important that we do not forget our preventative practices. COVID-19 is still here. It's still in our community. We haven't killed the virus. The virus is still here. And we need everybody to continue to practice these preventative measures to contain the spread of COVID-19. Thank you all for all your support, your words of encouragement, the donations. Again, thank you for everything that all the community members have been doing in terms of preventative measures and containing the spread. We are still in need of everybody to continue to practice these preventative measures. It's very important so that we can contain the spread and so that we also protect not only ourselves but the vulnerable populations. Thank you.
All right. Our first community speaker today is the owner of Boujee Berries, Akisha Hill. Akisha, the floor is yours.
Hi, thank you guys for having me. So I basically just wanted to explain my practices as far as the mandate and how I have been handling everything and dealing with the social distancing. Now, being that my business is a smaller, intimate business, it's really difficult to prevent people from exposure to each other. So we have decided, until there is no longer a mandate and the numbers start to decrease, that we will continue to remain closed. And we will also continue to service our community with the option of pre-orders and free delivery at this time. It's really important that everyone stays safe. We want to do whatever we can to assist with that. And as long as there are stipulations, there are stipulations for a reason. So we will continue to remain closed at this time.
Thank you, Akisha. All right, our next presenter is the owner of local Farrells Extreme Body Shaping in Cedar Falls, Angie Fuller. Angie, thank you.
Thank you very much, Sheriff. I'm Angie Fuller, and I'm pleased to share our work to implement processes at Farrells to reduce the possible transmission of COVID-19 at our facility. Since we suspended in-person classes at Farrells on March 13th, which also interrupted our plans for a grand reopening at our new location in Cedar Falls, we've been preparing how we would reopen, realizing there would be some restrictions in place to help slow the spread of COVID in our community. A healthy person has a much greater chance of fighting off the virus should they contract it. So we've worked hard on a plan that would help our members continue working on their fitness goals in a way that made them feel safe and comfortable, no matter their personal situation. We reopened today with a lot of preparations as we keep our members as healthy as possible. From the beginning, we lent out equipment to our members and are allowing them to keep that equipment until we are able to reopen without restrictions. That means no sharing of those pieces of equipment, which reduces the likelihood of transmission occurring. This also allows our members to remain at home for workouts, which since March 13th have been and continue to be delivered live and recorded every day. If they prefer to take extra precautions, they're allowed to do those workouts from home safely. We continue to design the workouts every day for both those in class and those at home. With the governor's restrictions on fitness centers, we are especially challenged at Farrells because we are a class-based fitness center. This means we can only have 10 participants per class. While other similar facilities have changed their programming to a general open gym format, we have chosen to continue the Farrells design of a quality class environment to help with encouragement and accountability. to increase the number of members that we can see each day for in-person classes for kickboxing and strength training. While still allowing for extra cleaning between those classes, we altered our schedule to increase our class offering from 8 classes a day to 10, with the possibility of adding 2 more if demand exists. We start at 4:45 a.m. and our last class ends at 9:15 p.m. We've kept our members updated daily with information over the last 10 weeks to keep them active while we were operating virtually. And now as we reopen, we've provided recommendations and some easy to follow rules to help them stay socially distanced while working out in a fun way to help them get back to the family culture that is Farrells Extreme Body Shaping. We recommend wearing masks when people enter and exit. We've posted reminders about socially distancing and hand sanitizing around the facility. We've capped our class sizes to 10 per the recommendation, and members register online to reserve their spot. We mop and sanitize all high touch point areas after every single class, and then we do an additional deep clean once a day. We've added additional hand sanitizing and cleaning stations for our members to clean any shared equipment. Members were already doing a great job of that. We are really big into high fives, fist bumps, and hugs, but we're doing those socially distanced right now. We've spaced our kickboxing bags at least 10 feet apart and marked the floor where the bag should stay to make it easy for our members to keep the required 6 feet apart. We've added new technology that allows us to continue live streaming classes daily for our members who wish to take extra precautions and stay at home. We maintain a positive attitude with a readiness to be flexible, so we can change our plan immediately depending on the governor's daily announcement. At any given time, we have 2 to 3 iterations of our plan ready so that we can be agile and pivot quickly if necessary. We know that the current restrictions may be changed in a few weeks, or they could last for months. We are prepared to do everything we can to maintain a healthy, safe facility, following the governor's proclamation to help our members and our community. This is a difficult time and we've all been challenged in very different ways, but the Cedar Valley is resilient and I'm proud of my members at Farrells for adjusting to the changes and working to continue their health and fitness goals.
Thank you, Angie. Our final presenter this morning is the owner of Hatchling and Hens gift shop, and it's Katie Bjerke. Katie.
Name right, Sheriff. Thank you. It is truly a privilege to be part of this press conference today. As small business owners, we are oftentimes a staff of 1 or 2, and so we're making a lot of these decisions in isolation on our own. And so for any opportunity to join with other business owners and kind of bounce ideas off of each other, that's always welcomed wholeheartedly, at least from my perspective. So again, I thank you for that opportunity. Hopefully what we're sharing today can help other small businesses through this process or give the general public some context for what we've been experiencing over the last couple of months as small business owners. So I also wanted to express great gratitude to this community for the outpouring of support, similarly to what Angie just mentioned. These have been hard times for everyone, and I know from at least my perspective, the amount of support and love that I've received from my customers at a time when maybe their futures are questionable, that's been so overwhelming and so humbling. So I just wanted to be sure to communicate my gratitude for that. I've found that if you're able to offer your customers an easy and safe way to do business with you, they'll show up wholeheartedly and in such a big way. Just for some context, my shop is located on Main Street in Cedar Falls. I'm primarily a retail shop, as Sheriff Thompson mentioned. We carry locally handmade goods, but I also have a make and take craft studio. I was asked to share today what we're doing to reopen. First, the term reopen is not really accurate for a lot of us. After closing on March 16th, I was able to pivot pretty quickly to an online store, and which I did not have before the pandemic. And like most small businesses, I've been hustling behind the scenes, trying to figure out how to do business differently, filling online orders, working tirelessly to keep up with social media. Anything that gave people a way to shop with me, even when my doors were closed. So we've really been open, even though our doors have been closed. And I bring this up because as you start thinking about visiting your favorite small businesses, I really do believe it's important to remember that many of these business owners and their staff are entering this next phase pretty tired, pretty exhausted, and frankly, pretty fragile from the last 2 months. It's important to enter these spaces with grace and with understanding. We're also very excited to be reopening, but for many of this has been a time of overcoming huge hurdles, and for some of us, a time of mourning. We've experienced great loss through our own businesses or through watching some of our neighbors struggle and close, and we're worried for our neighbors and colleagues who are still not able to reopen. So most of us have lost sleep over whether we're doing the right thing, whether our businesses will survive this, and how to take care of our staff that rely on us for their livelihood. So we're broken and we're tired. So it's just important to remember that it will take time for us to regain our stamina. Some of us may never be able to return to what we were before all of this. Small business in particular are most definitely not back to business as usual. So please remember that as you plan your outings. The beauty of small business is that we're all independent owners. But what can be really hard for you as our patrons, and what can be pretty discerning, is that we do all have different policies in place. Whatever makes the most sense for my particular business might not be what makes the most sense for Angie's business or for Akisha's business. So remember that as you plan to visit, that just because policies are a certain way in one location on one day, that may not necessarily be the same case at your next stop or the next day. I've always tried to keep in mind when shopping small business that you should be prepared for anything, and then you'll be surprised by nothing. Not all businesses are requiring masks, for instance, but have one handy just in case. Be sure to check doors of businesses before you enter, because a lot of them have signage on their doors that outline their policies. And especially for businesses like mine that are pretty small, and Akisha said hers is pretty small as well, be especially conscientious of the 50% capacity that most businesses are required to follow right now. For a lot of small shops, that means as little as 3 or 4 people in the shop at one time. So before you enter, do something as simple as checking with the person at the counter to make sure that it's okay if you come in. Because many of our small businesses have small staff, it's hard for us to manage the policies we're asking you to follow. We're counting on you as individuals to help us navigate this time. I wanted to be sure to mention these points before I get into what I'm doing specifically, because while I can express how grateful I am for this opportunity to speak, it seems a little strange for me to be representing small business because what I'm doing can look so different from what my neighbor is doing. So just keep that in mind as you continue to visit these businesses that are reopening. So as far as what we're doing to prepare, I opened last Friday. There was first the really simple act of getting my shop ready to be presentable again. Imagine how your home has maybe looked over the last several weeks. We're just all trying to survive, and maybe we're not practicing our normal habits of tidiness and organization. And then imagine you're given a few days notice that you'll be hosting a party. It's a little discerning. I've been operating on my own while I was closed, but now I've got to be sure that I'm keeping my shop safe for my customers and also my staff. So the last week, I spent a lot of time deep cleaning, organizing, thinking about my floor plan, if I could open it up more so that there was more social distancing possible, and making my shop sparkle again. Quite a bit of thought has also gone into what policies made the most sense for my specific business. Many of those have been decided for us, such as the social distancing and the 50% capacity. I know restaurants in particular have an exhaustive list of requirements, but many other things have been left to each individual business to decide, which again goes back to show how important it is to check the policies for the business you're visiting before you enter. For me personally, I've decided to implement a mandatory mask policy. That's for my own safety and also for the safety of my customers and my staff. We don't always know the history of our shop owners or the customers that are visiting. My husband happens to be a paramedic and a firefighter for Waterloo Fire Rescue, so he's oftentimes in contact with people who've been infected. And while my family is currently healthy, we just don't know what any of us could be carrying. So I've decided it's the most responsible thing for me to require masks. And at the end of the day, I can feel good that I've done everything I could to protect those who are visiting my shop. We are also sanitizing high touch areas every hour, similarly to what Angie described. I can't possibly, because I'm a retail shop, I can't possibly sanitize everything that my customers are touching, because that's the whole point, is that they come in and touch and shop. But I am paying particularly close attention to high touch surfaces like counters, checkout counters, light switches, door handles, stair railings, our tablet, which we use for transactions, and our credit card reader. I do want to mention here too that these sanitizing products can be hard to find right now. So if you are a small business owner, you know, some of you may not even be familiar with where to find them or what the best product is for you to use. And sometimes they're only available in bulk, which might be way more than what you might need for your small business. So reach out to others in your immediate network. Another business owner here on Main Street who uses a sanitation system, she's a food provider, offered to fill a spray bottle for me so that I'd have a small amount for have a small amount that I needed for my shop. So I encourage you to get creative, work together as business owners. Is there some way that you can share the burden of getting some of these products and save yourself what can be a decent investment at a time when every dollar counts? In my own shop, I've also removed anything that might be a high-touch item but isn't essential for doing business, something as simple as putting pens behind the counter. Signatures are done with a finger on a tablet, so that's used for transactions, and it's rare that someone needs to use a pen. So I've just eliminated that altogether. It's easily accessible behind the counter if I need it, but I don't have to worry about that thing having to be cleaned every hour, and every small effort can add up in a big way. For transactions, we're also trying to make them as touch-free as possible. If a signature is required, we're asking customers if we can sign for them. We also hold the credit card reader steady, so they're able to insert their card without touching the actual reader. The only thing that they should be required to touch for transactions at my shop is their own card or their cash if they're paying with cash. Our bathroom is still open to the public for use. We don't typically have a high percentage of customers who ask to use our restroom, so for us to keep it clean is fairly easy. But we are, once a customer uses the restroom, we are sanitizing with that same spray that we're using on door handles and countertops. And then finally, we're keeping hand sanitizer by our door and have asked customers to use it as they both enter and leave the shop. Since I am requiring the use of masks, and because my checkout is small, I've decided against a plexiglass shield. However, I do know some businesses downtown in Cedar Falls that are choosing to use a shield at their checkouts, and that can be another really easy way to help protect employees and customers. Because we're not back to business as usual, and because doing business face-to-face can be pretty draining right now, I've also reopened with limited hours. And I would expect that a good majority of small businesses will be reopening on a smaller scale as well with limited hours. So also keep that in mind as you're venturing out. The typical hours that you expect from some of your businesses might be different. Right now, our storefront is open Tuesday through Saturday, 12 to 4, but in normal times, we would have been open Tuesday through Friday, 11 to 5, and Saturdays, 10 to 4. So we are kind of cutting that back quite a bit. Foot traffic is not at all what it was before the pandemic, and I know that's going to continue to increase and start getting better. But for now, those limited hours are really what makes sense for us. Hopefully, as things improve and more businesses are able to reopen and more people are venturing out, our hours can reflect that change. We continue to offer online ordering. I wanted to mention that as well. We have always done online ordering since we closed, and we'll continue to do that even though our doors are open. We also offer alley pickup and in-town delivery. So if you don't have to come in or you don't want to come in, we're still able to take care of you with those options as well. As part of my business, I also have a craft studio. It's a make and take studio that serves primarily children for walk-in crafting and also birthday parties. This is one area of my business that's been especially hard hit. We've had to reschedule several birthday parties, canceled them altogether, and the studio is actually currently serving as our shipping and order fulfillment center. It's hard to say when we can reopen that portion of our business. There are so many high-touch surfaces in that space, and the seating is so close together, and there's really little guidance from the state on how we should be handling that portion of our business. I bring this up because we don't really fit into any one specific category of business that the governor has addressed with her proclamations. So we've just kind of had to interpret what category we fall into. what categories of business have similar functions, and then what are the recommendations for those similar categories to reopen, and just do our best to make that decision based on the information that we have. What I do know is that until there is no longer an emergency declaration, we will probably continue to have the studio closed. We're offering art to go in the interim, which has been a huge help, but is definitely not business as usual. It's definitely a whole new way of doing business for us. And I hope that by sharing my story, I've been able to offer some perspective to those of you who plan to visit small business in the near future. For those of you who own small businesses, hopefully we've been able to offer some helpful tips. And I truly do believe that we're all in this together, and we're only as strong as our weakest link. So I ask that you continue to be vigilant in the measures you're taking to help curb this pandemic. Please continue to support small business and shop local. Even though our doors are open, we need your support now more than ever. Above all else, please remember to handle small businesses with care. The best way you can support us right now is with understanding, kindness, and patience.
Thank you, Katie. Well done. Katie, Angie, and Akisha, I hope that you're all three willing to stick around with us for just a bit in case there are questions for you. I would be remiss if I did not indicate a great and deep appreciation to the folks at Grow Cedar Valley for their assistance in helping us set up this opportunity to get a great sampling of Cedar Valley local businesses. We had a wonderful meeting with them this morning. We met with close to 70 business members with Grow Cedar Valley this morning to talk about recovery, to talk about some of the things that they needed to be aware of, both from what it looked like to stand back up, some of the rules, the regulations, as well as some of the opportunities and interactions that are available out there. And we certainly stand here today to champion the small business as well as the business community as a whole here in the Cedar Valley. And so we hope to see continued growth and prosperity because of some of the interactions that we've had the opportunity to have, both with Grow Cedar Valley, but also with some of the opportunities that have existed in lieu of the COVID-19 pandemic. So with that, that concludes our prepared remarks today, pending your questions.
We have a question from Caroline Cummings with KGAN in Cedar Rapids. Last week, officials said they had not received Test Iowa results from the Waterloo site yet. Has that changed, and when will?
We are getting results from the Waterloo site. My understanding is, and I believe I'm talking correctly, I believe that they tested 51 on Friday. I believe that was the correct number, or was it even higher on Friday? I think maybe it was 51 on Thursday. 51 was Thursday and 70-something was Friday, 71, 75 on Friday. So we are getting accurate numbers to answer that question.
There have been 2 cases of multi-symptom inflammatory syndrome found in children. They said they were found in eastern Iowa, but didn't provide any more updates. Are either of those cases in Black Hawk County?
Sure. I'm going to have Dr. Nafissa talk with regard to that similar Kawasaki case in children.
We have not had any information in regards to those cases in Black Hawk County.
Is there a plan in place? Have you talked with the hospitals about this syndrome? And if so, are they doing anything different? I know you mentioned testing children at child care centers has opened up now. Is that part of this?
Yeah, so they would need, it's one of those things that they would need to report. So those are some of the reporting guidelines that IDPH has provided.
Reynolds has indicated she believes the state has robust testing in place. In the county's opinion, is there sufficient testing right now to get a handle on the spread of the virus, the continued spread?
So that's a tricky question because we do know that there are people that carry the virus but are asymptomatic, right? So I think unless we have mass testing, it's really hard to define how the impact of COVID-19 on the overall county. We are fortunate that our local healthcare providers have enough test kits, and we've always been engaged with them to determine whether they need the additional test kits and where they are with supplies, and we'll continue to do that. But I think, with the understanding that there are people that have COVID-19, and there's asymptomatic. We truly, until we test just everybody within the county, we don't have a good understanding of the scope of this illness.
Would there be a threshold of testing that you would be more comfortable with? Like if we could get to, a test rate of less than 10%, like the WHO has recommended?
I think anybody presenting with symptoms should be able to test, but right now that is only through the lab reference, so that they can do. But with the Stay Hygienic Lab, we have very specific criteria. So I think once that opens to whereby our hospital systems are using reference lab, and we have more the ability to test as many people that present with just the symptoms, I think that's really what is going to be indicative of where we're at.
We have a question from Taylor Vessel. Taylor, you are unmuted. Go ahead with your question.
Thank you. Hello, all. Just wanted to see if there was an update regarding staffing at long-term care facilities. And then on the same topic, Governor Reynolds mentioned earlier today, or she was asked, Vice President Mike Pence suggested testing every resident, every staff member of a long-term care facility. Just curious where we stood within the county, if there was a percentage or something in terms of how many residents and how many staff have been tested within that particular industry.
So for the county, Friendship Village, 40 cases, residents and staff. And these are the testing, correct, Josh? Yeah, the cases. Harmony House, we have 85 cases. New Aldea, 13 cases. And Pillar, 5 cases. And then have they all been tested?
Do you want me to speak on that?
Yeah, just...
Yeah, eight facilities have not been tested.
8 facilities, but we've had the 3 that we've had all the residents, 4 of everybody been being tested. Mm-hmm.
Just to clarify, you've tested everyone at 4 facilities, you said, or 3?
4.
Are those the 4 that have outbreaks?
Yes, correct. And then in terms of the resources,
In terms of staffing resources, right now we have shared every resource with those local agencies that we have available. In fact, this weekend I was working with New Aldea on expediting background checks within my agency to help expedite hiring processes through, I'm not sure that it was the iServe list, which is a list that comes from the State Emergency Operations Center, but we are assisting in streamlining those processes for them as well to try and expedite replacements and temporary hires to be able to facilitate some of those folks that are available from other places in the state. There are still people that are in yellow, which would be cautionary or concerning levels of staffing, but we aren't nearly as concerned as we were last week when some of those facilities were into a red status.
Can you talk about what yellow means?
So the question was the green, yellow, red statuses. We use those in about everything, whether we're talking PPE, we're talking about staffing levels, we're talking about whatever. Green means we're good to go. We've got what we need. We're operational. We're fully mission capable. When we get into yellow status, it means that we may not be fully mission capable. It means that we may have to make some operational changes to be able to continue to maintain mission. It means that we are starting to become concerned about our staffing level or our supply level of PPE, whatever it is. When we go red, it means that we may no longer be mission capable. We may be to a point where we can no longer function at the operational level that we're required to be. And so those 3 levels give me context here at the Emergency Operations Center at the planning and operations level when we get those briefings, either from RMCC or from those ESFs every day, either at the staffing briefing or at the 1 o'clock planning meeting. That gives me the context of where we truly sit, that once over the world every day. Plus I do current operational period and then 24 to 48 out for everything, whether that's staff, whether that's PPE, whether that's just operations, whatever it is. And so when we start getting into that yellow-red nomenclature, it starts to get me awfully nervous.
Is that a certain percentage of staff?
It really, I don't put a qualifier on it. I actually ask them to condition that themselves. So they may have a different level for Friendship Village than they have for New Aldea, because each of those have their own complexities, right? Depending on what unit they're talking about. The fact that Pillar now has an outbreak, and we know that Pillar has a PMI unit, a persistently mentally ill unit, where we know Harmony House has TBI units, traumatic brain injury units. So their complexities may be way different than just a long-term care facility where people are there for those tender years of life. And so I don't condition what necessarily green, yellow, red means to each of those facilities. They condition that based on what they recognize their operational levels to be.
We have a question from Iowa Public Radio, Kate Payne. Kate, you've been unmuted.
Thank you. So a follow-up on Taylor's question earlier. Are there efforts to get every resident, every staffer at all long-term care facilities in the county tested?
Great question, and the answer is yes. Yes, all of the facilities, the 4 that are in outbreak status were obviously triaged first, but all of the other 8 that have not been currently tested are certainly eligible for testing. They have been provided information to facilitate that testing, and that testing is in the process of being affected now.
Since you mentioned Pillar was added to bring Black County to 4 outbreaks, how many more is the county monitoring?
Right now, we are not in current monitoring status of any additional ones that I'm aware of, and I'm looking at Josh Pecora when I say that. I'm not aware that we are currently monitoring any more. Are we still at 5? We're currently monitoring 5?
2 others with positive residents.
Okay, so we still have 2 that have positive residents, but that are not at outbreak status.
So those 2 you are monitoring?
Correct.
Regarding the convalescent plasma treatment that you had mentioned earlier, have either Unity Point or Mercy One shared whether that's been successful as we go along?
I will let, you want to answer? Oh. Yeah, okay, so regarding convalescent plasma, reference serology testing and those kinds of processes, with regard to the hospitals, we would have to reference you to the hospitals, and unfortunately I don't have those representatives here today. I apologize for that.
We have a question from Kate Payne, Iowa Public Radio.
Yes, Kate.
Kate, you've been unmuted.
Thanks. So to follow up, Sheriff, for all the testing that you said is available to every resident, every staff at the long-term care facilities, what is the total of how many people that is? And do we have a timeline for when that'll happen?
I'm sorry, I don't have either. I don't have the total numbers, just that we work through that RMCC, we work with that coalition, and we work through this region to facilitate that, and those tests have been made available to those facilities, and those facilities we communicate with very frequently, in fact daily, through the health department and through the RMCC. And so I wouldn't even venture to guess the total numbers, but that conversation started early last week, and I reaffirmed that conversation this afternoon at our 1 p.m. planning meeting to make sure that that information is flowing and the communications are being shared. Any other questions? All right, folks. That concludes our planning, or I'm sorry, not our planning meeting. That concludes our press briefing for today. We have one more? All right.
Kate Payne, Iowa Public Radio, go ahead, you've been unmuted.
Hi, thanks. For Dr. Egbuonye, I'm hoping that you could tell us more about the change in testing criteria for the state hygienic lab, testing for children and what is the level of concern about those impacts with this inflammatory condition for kids?
So I think one of the things is for the state to be, and for local public health departments as well, to be able to assess what is going on in terms of the multi-system inflammatory syndrome in children. So that is one of the things we've noticed as studies have been coming out, that it's associated with COVID-19. So again, it's to make sure that also we're providing the necessary care for children that are presented with respiratory illnesses, and they can't determine anything else. So I think this is a good effort that the state is doing in terms of providing that opening the testing for the children.
Dr. Nafissa, Carolyn Cummings from KGAN wanted a clarification on the 21 inconclusive tests. That's out of how many tests? Is that out of the 1843, or is that out of the Test Iowa?
That's how many? Oh, that's out of the 7,074.
Total tests for the county.
Total tests for the county, yes.
Any other questions? Seeing none, that will conclude our press briefing. We do have one more. Sorry. All right.
Kate, you've been unmuted.
Do you have the total for how many Test Iowa tests have been conducted in the county?
The Test Iowa tests. We do not have that total. We do have access to that, though, Kate. I know where I can get that number. I've purposely not really tracked that. I know anecdotally that if I broke it down by days, we would be about averaging 12 per day, because I did some calculations on that earlier. But I can get that number to you, and I'll have Lori Glover, our EM director, send that to you. Deal?
Okay. All right, thank you.
Kate, do you have any more questions before I conclude this press conference?
I'm good.
All right. That'll conclude the press conference for today, folks. On Thursday, we are going to look at having some of our community partners that we actually need some do-overs on. Some of the outreach folks with Embark and Liberian groups, some different folks that we have been relying on heavily, but that tend to work a little more behind the scenes with us. And so we're going to work on that, and it says TBD right now, and it's still TBD for now, but we'll continue to work on that and get that set up for Thursday. But thank you. What's that? Oh, that's right. And then Monday is obviously a holiday, so then we'll go Thursday and then again on Thursday. There will not be a make good on Tuesday of next week. It'll be Thursday and then again on Thursday next week. Deal? Thank you very much, folks. Have a safe day.